Hello, everyone. This is Nicholas Marion, and we are going over the oral health in America. This is pretty much going to be the summary of, obviously, as you can see, the Surgeon General's report. So, oral health means a lot more than having just healthy gums and teeth. It really is an integral part to general health and well-being to pretty much all Americans, even globally. Furthermore, oral health must be integrated into the provision of healthcare and design of community programs as well. Because much has been said about having a safe and effective means in maintaining oral health. Can definitely improve health and prevent diseases, especially us as Americans over the past half century. So, according to the Center for Disease Control and Prevention, coordinated effort can overcome the educational, environmental, social, health systems and financial barriers that have created vulnerable populations whose oral health is at risk. So it's definitely a big topic of concern. Now, the for Disease Control and Prevention identified 4 divisions of oral health that must be addressed. And those ones, as you can see on the screen, are children's oral health, adult oral health, periodontal disease, and oral cancer. So the first one is tooth decay. Tooth decay are basically cavities, and it's one of the most common chronic conditions of childhood in the U.S. Untreated tooth decay can definitely cause pain and infections that may lead to problems with eating, speaking, playing, as well as some learning disabilities as well. So definitely very important. So number 2 is adult oral health, and oral health is not just applicable to kids but also adults. There are threats to oral health across the lifespan. In addition, nearly a quarter of all adults have experienced some facial pain in the past 6 months. Oral cancers are most common in older adults, particularly those of over 55 who smoke and are heavy drinkers as well. So that's definitely a biggie as you become an adult. Number 3, periodontal diseases. So this disease is quite evident among adults. Periodontal diseases and tooth decay are the 2 biggest threats to dental health. And lastly, you have the oral cancer. So each year, more than about 30,000 new cases of cancer of the oral cavity and pharynx are diagnosed, and over 8,000 deaths are due to that oral cancer as well. So hence, early detection is key to increasing the survival rate for these cancers. So health educators should definitely aim at preventing high-risk behaviors such as cigarette use, cigar smoking, pipe smoking, the continuous use of tobacco, and excessive use of alcohol. So this third slide here, about 20% of kids, just some facts here, 20% of children aging 5 to 11 have at least one untreated decayed tooth. 13% of adolescents aged 12 to 19 years old have at least one untreated tooth decay. The Center for Disease Control and Prevention made mention that the rate of children and adolescents aged 5 to 19 years old with tooth decay is higher in low-income families and accounting for about 25%, while there's only 11% in the higher income households. So it's an interesting fact. Adults' oral health, nearly 1/3 of all adults in the U.S. have untreated tooth decay, which is rather scary. 1 in 7 kids aged 35 to 44 experience gum disease, which increased the risk to 1 in 4, excuse me, the typo, for adults aging 65 and above. So it's one of the periodontal diseases, very common infections and inflammation of the gums and bone that surrounds and support the teeth. So the first signs obviously are inflammation and certain infections. This condition would start as gingivitis, and if left untreated would definitely lead to periodontitis. And some of the stats suggested about 47% of adults of 30 years and above are diagnosed with periodontitis. Moreover, periodontitis increases with age. About 70% of adults 65 or older have these diseases. So definitely take care of your gums, people. Oral cancers now. So there's about 30,000 reported cases of new oral cancer in the oral cavity and pharynx, and there are about 8,000 reported deaths attributed to that as well. And so again, mortality rate of this is nearly twice as high as in black compared to whites. Okay, now, so the Center for Disease Control and Prevention was able to formulate some goals on how to address this existing issue of oral problem in the U.S. And the first goal was obviously to prevent and control dental caries, excuse me, across the life stages. And their first goal would include characterizing the burden of dental caries across the life stages of an individual, followed by developing and promoting effective evidence-based strategies and intervention to prevent dental caries. So one example would be effective evidence-based interventions exist to prevent and control tooth decay and reduce healthcare costs. Notably, community water fluoridation, which reduces dental decay in children, adolescents, and adults by about 25% across the lifespan, and school-based and school-linked dental sealant programs would definitely reduce decay by up to 60%. So second goal, prevent and control periodontal diseases. This basically entails improving the surveillance or periodontal infections and their risk factors, building an evidence base of effective strategies and interventions in periodontal disease. Surveillance of these diseases has traditionally focused on complicated assessments of multiple sites inside the mouth. These assessments are extremely resource intensive and often are outside the capacity and resources of state and local surveillance systems. So to address this gap, CDC has worked with the American Academy of Periodontology and other experts to develop and validate self-reported measures of periodontal infections to be used in surveillance and as screening tools. So that's a good proactive approach. Third goal, prevent and control oral and pharyngeal cancers and their risk factors. So this would focus on improving the surveillance of oral phalangeal cancers and their risk factors, as well as building an evidence base of effective strategies and interventions to improve early detection of oral and pharyngeal cancers and to reduce incidence of mortality. So oral and phalangeal cancers, which are like basically cancer of the lip, tongue, floor of the mouth, palate, alveolar mucosa, and things of that nature, continue to pose a threat to health of U.S. adults, with no marked improvements in survival rates over the past several decades. So in 2010, estimates show that more than 36,000 people learned they had mouth or oral cancer, and more than 7,800 people died of these diseases, about 5,400 being men and 2,400 being women. Early detection is important because the 5-year survival rate for early stage cancer is approximately 80%, while the survival rate drops to 9% for late stage disease. Goal 4, eliminate disparities in oral health. This goal aims to broaden the understanding of an individual regarding health disparities, determinants of health disparities, and evidence-based approaches to address disparities in oral health. Goal 5 would be promote prevention of disease transmission in dental care settings. So a strategic initiative that provides an evidence-based dental infection control and information and recommendations while maintaining the current high levels of adoption of the current CDC infection control guidelines into dental practice. Excuse me. So now, excuse me. At the time, most of these programs only consisted of a state oral health program director and administrative support. So since then, the CDC has definitely worked with funded states, national partner organizations, and national consultants to more fully define the essential components for developing and enhancing infrastructure to basically help these state-based oral health programs. Goal 7 now is to increase use of cross-cutting policy development and translation approaches to promote oral health now. So another strategic initiative that increases the capacity of oral health program to promote oral health through development and implementation, excuse me, of a macro level perspective policy approaches at the same time, motivating the oral health program to use evidence-based strategies to translate and disseminate CDC guidelines recommendations and effective preventative interventions, especially related to fluoridation, sealants, and infection control. And lastly, the goal 8 is to assure an efficient and effective organization. So this goal pretty much aims to improve the organizational capacity and functioning of oral health programs, with an emphasis on increasing leadership effectiveness, partnerships, and workforce development. So definitely the reference on this would be of the CDC and prevention, which basically I got the reference from. So hope you enjoyed that, and thank you very much.